This is a patient who ended up getting a carotid artery ultrasound, and the thing that I wanted to point out is the amount of time that it takes for the common carotid artery to reach its systolic peak. And so I drew some lines here that indicate when does systole begin and when does systole end. Now we look at the x-axis down here, which is the time. The y-axis is going to be our velocity, but the time axis here we can see that each one of these numbers represent seconds. So each one of these hashtags within there are 10 of these each equal 0.1 seconds. And so the amount of time that it takes to reach systolic peak within the common carotid artery looks to be about 2 of these, so this is 0.2 seconds. This is a prolonged acceleration time. Usually the amount of time that it takes to reach the peak is 0.07 seconds. And so this is much longer than it should be. So this is a delayed upstroke. If we look at the other arteries on the right, we can see the common carotid artery distally still has this delayed upstroke. You can see the delayed upstroke with the internal carotid artery. And when we go to the vertebral artery, we can see the same phenomenon. If we look at the left has the same delayed upstroke. Here you can see the internal carotid artery proximally has this delayed upstroke, and it is seen in all the vessels. So when you see this delayed upstroke, we really think about a more proximal stenosis that is causing this. In this particular case here, we're thinking, okay, it's in both carotid arteries, so it's something that's in common proximal to the carotid arteries. This ended up being a case of aortic stenosis. This patient had aortic stenosis that led to these waveforms in the carotid and vertebral arteries. So take a look and just make sure to take a look and see whether there's a delayed upstroke. If there is a delayed upstroke, think a more proximal stenosis.